Hey guys, I want to continue our conversation on blood sugar. We are going to be talking about blood sugar and hormones. So I'm going to give a super vague overview of this because it gets super complicated and it's very, very, very specific per person. So as a general rule, blood sugar is driven by a couple of things, and your hormones are definitely one of them. For example, insulin is a hormone and cortisol is a hormone, and we've already talked about how important those are in regulating your blood sugar. Well, so is testosterone, estrogen, and progesterone. Those are also hormones that definitely manage blood sugar, or help affect blood sugar rather. So with testosterone, what we usually see is an increase in testosterone can drive up blood sugar, but so can a increase in estrogen. So we see this crazy imbalance where you become estrogen dominant and testosterone dominant kind of simultaneously, and this happens in a lot of women specifically, but then over time you will, especially in men, you will actually see that testosterone drops and estrogen stays up, and this problem perpetuates some of the blood sugar disorders that we're seeing as a whole. Now, I want to give you an example of PCOS because it's a fantastic, easy to understand example. So PCOS is polycystic ovarian syndrome, and really it is almost 100% a blood sugar management issue. Now, basically it is that you have cysts on your ovaries, and it is driven by increased blood sugar, and so you start seeing a estrogen dominance, a testosterone dominance. You might start seeing things like, as a woman, you might start seeing extra hair in places, or you would definitely see weight gain, acne, those kinds of things. Some things might be more extreme. There are definitely more extreme examples, but as a general rule, those are the things. Heavy periods, very painful periods, those are definitely common. Now, and eventually in late stage, you start seeing the cysts on the ovaries, and that can become a huge problem and can make you infertile. So the crazy thing is that if you bring down your blood sugar with PCOS, you can reverse PCOS. You will bring down your testosterone, you will bring down your estrogen, and all of these things start managing better. And it almost exclusively clears up with this, but we don't treat it that way. We treat it with birth control, and it is almost exclusively a blood sugar issue problem. So if we can help manage that, then the implications of that are huge. There are a lot of hormonal problems that are driven by your blood sugar, but are maybe not be caused by the blood sugar. They might just be exacerbating that, but there is no situation in which hormones and blood sugar are not somehow having some interaction. So even if you're talking about like someone who is in menopause, they tend to have blood sugar dysregulation issues as a result of menopause, or as a result of having a hysterectomy, as a result of having low T. All of these people have blood sugar dysregulation issues, and whether it's the cause or a symptom of it is a little bit unclear, but for the most part, they always go hand in hand. So regulating your blood sugar is crucial for anything hormonal that you have going on, and I promise you that it will make at least some of that better, because in all of those cases, because it really, really fuels that fire. I hope that helps, guys, and if you have any questions, put them in the comments and we'll continue to talk later. Thanks, guys.